Today's presenter is Dr. Michael Parmley. After completing a 2-year church mission in southern Mexico, Dr. Michael Parmley graduated from Brigham Young University with a BS in computer science. He went on to medical school at St. Louis University in Missouri and then completed his internal medicine residency at the University of Arizona in 1998. He was in private practice for 12 years in the California Central Valley. In 2010, he returned to the San Francisco Bay, where he is originally from, and began practicing medicine in Fremont. Dr. Parmley is board certified in internal medicine and is a fellow of the American College of Physicians.
Good evening. Nice to see everybody here. So what I kind of want to talk to you today about is how do you talk to a doctor? Now, let me give you an experience from my own life. So I just got out of residency. I was starting to work in Visalia. You know, I knew everything. I was awesome. And I'd sit down and tell the patients everything they needed to do. And then I'd go out of the room and the nurse would come in and say, Dr. Parmley, the patient wants to know what to do. Okay. Well, apparently that's not abnormal. They did studies and they found out the longer doctors were in the medical training system, the worse they got at talking to people. They don't know why. Is it the stress? Is it all the hours? Is it the patient load, the learning, whatever? For some reason, you know, doctors just got worse at talking to people and trying to explain what's going on. And they did a study where they looked at orthopedists. It was like 700 orthopedists. And they asked them, how well do you think you tell these things to the patients? How well do you think you educate them? And 75% of them thought they were awesome. Yeah, the patient knows everything I wanted them to know. And when they asked the patients, only 21% of the patients thought they understood what the doctor was telling them. So why is that? Well, it's complicated, but most of the time it's come down to sort of a mismatch of perceived authority or perceived position. Especially in the old days, you know, doctors would be like, shut up, listen to what I say, take the medicine, go away, I don't want to talk to you. You know, we've realized that that's not a good model. And so now we're more of kind of a, you know, give and take. Let's talk about this. What's going on? This is important in your life more than it is in mine, so tell me how you feel. But still there's some of that persistence, especially in some of the cultures that I treat, the people that I treat, they just really sometimes defer to the doctor too much. And that's one of the problems. So that's you know, so it really makes it my problem to try and sort that out. You know, so we're all, we all try and educate ourselves on how to better communicate with people. But there are some things that you guys can do to help make sure that we're not screwing up and that we're explaining it to you well. So, I mean, one of the most common things is I'll sit there and I'm talking to somebody and I'll say, okay, you have high blood pressure and we want to get your blood pressure down and I want to take this medicine. Does that make sense? You know, they just nod their head. Okay, great. No, and then if I say, so what are you going to do? I don't know. You know, and so that's why we have to sit down, you know, and so fortunately there's been a lot of training and things for healthcare providers to try and get better at communicating, because that's not really part of the core curriculum, or it didn't used to be. It sort of is now, but before it was just, you know, hearts and livers and other things. But now it's also, hey, the patient. The patient's not a collection of a heart, a liver, a stomach, and everything. The patient is a person. So you have to figure out, how can you talk to this person? Well, first of all, you have to be a person, so they try and make it more humane in the training. Hopefully that'll help too. So these are the kind of things that I tell people to do, and they're fairly common sense, but sometimes you have to plan ahead to do them. One of the things that I recommend is make a list. Now, I mean, everybody's probably heard that before. Make a list of your questions. But there's a couple of things about those questions you need to know. First of all, one time, seriously, a guy came in with the old fanfold papers and went, okay, doctor, and I'm like, whoa, you know, it looked like it was 20 pages that fell down. That's not going to happen in 15, 20, 30 minutes. So you should put them in order of importance and really focus on 3 or 4 questions that you really want answered, that you really think is important. Of course, it's also important, some people don't want to know. Now, I find that a little disheartening because, you know, when I ask people, so who's in charge of your health care? And if they say, you are, doctor, I'm like, really? No, you are. I'm here to help you. But you're in charge of your health care. So it's disheartening when people come in and say, I don't know what medicine's on. I'm on the blue pill and the white pill, and it's doing okay. And it's important that people try to do it. Now, sometimes people don't have the capacity for that, and that's a different issue. They're just, you know, they have a lot of medical problems, and so they need help, and that's what we'll come to in a second. But the first thing is focus the questions. Think about it. What do I really want to know? What are the top 3 or 4 things? Sometimes that is not enough. Sometimes you really do have 20 things that are just really important. Occasionally, we'll have to reschedule, or you could ask for more time. And sometimes some doctors have more flexibility in their schedule where they can schedule at a spot and give you more time. And you can sit down and go over those things. I know one doctor, a gastroenterologist, schedules his patients who really have a ton of stuff to go over at the end of the day. And then they'll just sit and try and answer all the questions. Because you gotta remember, whenever you see us late and you're all, dang it, I'm gonna charge that doctor a late fee, you know? Which is, you know, the problem is usually, like today I got stuck in with 2 patients that were in together and spent an hour and a half in there because they were so complex. And the next patient, of course, was angry and upset that I was late. So I'm stuck with, who am I gonna get mad at me? You know, and that's kind of the pressure doctors are under. And don't let a doctor get away with going, not another list of questions. Don't let them get away with that. That's unacceptable. They did a study and they found that if patients listen to doctors, it adds up to maybe 90 seconds on a visit. That's nothing. You know, if you just listen and ask your questions and try and communicate and understand each other, then, you know, you can get your questions answered. Now, sometimes what I'll say is, patient, I like people to tell me at the beginning if they have if they have questions too, and I think you should let your doctor know. Because they're trying to budget a lot of things in their mind. They're trying to budget the time that they have to spend with you. Then if you have a medical problem or like diabetes that you have to go over, they're thinking, well, let's see, how much time do I have? I need to go over, you know, how are their sugars? What labs have they been done? Are their feet okay? Have they seen their eye doctor? Do they need refills? You know, you have to think about all these things. And then at the end, you know, some people, then you'll get the, oh, by the way, questions. And it's been shown that the by the way questions get ignored. But the by the way questions are almost always the most important to the patient, the persons that's asking. You know, they just never felt that the time was right to bring it up with the doctor. I have an example of that. I did a full physical on a guy. And it's hilarious because I asked questions like, are you chest pain? No. Shortness of breath? No. Everything's fine. Did the whole thing. Hey, you look great. Oh, by the way, doctor, at work, I work on a warehouse. And every time I walk across the warehouse, I get shortness of breath and my chest feels like it's being squeezed. I'm all, what? You know, so we're already 5 minutes over, and I'm like, okay, I guess we can't give this up. You know, if the guy said, oh, my head itches, we maybe said reschedule. But, you know, and 3 days later, the guy had a bypass surgery. You know, so again, that's why I think it's important to bring those things up and let the doctor know you're going to ask a few questions at the end. If you try and ask him 20 questions, first of all, he's going to race through them. He may not be able to concentrate on them, but you're not going to get anything out of it either. Like I said, there's no problem with coming back to see him later. I just hope your copay's not too high. I know that's always a problem. But anyway, so questions, ask the doctor. Most of us are happy to do it. We may not even get that you don't get it. That's part of the problem. If you're just going like this, or people are going like this, we're like, oh, we're so smart. We explained everything, and the person is just, may not understand. And don't be embarrassed to ask dumb questions. You should see doctors when they go into, you can tell the difference between medical students and real doctors when they go into a lecture, like a cardiology lecture, an advanced lecture. The medical students are like this. They don't ask any questions because they're embarrassed to show that they don't know anything. And the rest of us are like, wait, that EKG doesn't make sense. Wait, what is that? I don't get that. Because we want to figure it out. We ask dumb questions, like the cardiologist would think we're asking dumb questions. He's probably like going, oh my gosh, how'd this guy get through medical school? But I mean, the point is, everybody's at different levels, and don't be afraid to ask. So that's one of the other things is ask, ask, ask. If you don't get it, don't leave it there. Don't leave until you understand what's going on. If you don't get it, you haven't had a good medical visit. If this guy may be the best oncologist in the world or the best cardiologist in the world, but if you don't understand what's going on, it wasn't an appropriate visit. Ask, wait, doctor, I don't understand. What do you mean by this medicine? Or what do you mean by heart failure? That sounds terrible. Am I going to die? What does it mean? I mean, seriously, I use congestive heart failure all the time. And so to me, that's like, oh, it's a condition where the heart can't keep up with the demands of the body. Patients hear heart failure and they think they're going to die, which sounds reasonable. Heart failure. Heart fails, something bad happens, I think. I don't know. I played hooky that day in medical school, so But that's the problem, is our level of understanding certain topics. And so that's why sometimes even when you ask a question of a doctor and they seem blasé about it, well, what about my heart failure? What's that all about? Oh yeah, it's just heart failure. Because we see it so many times in so many people, and it can be from super benign to fatal. And so in our minds, we're like, oh yeah, but you have the benign kind, you're going to be fine. And they're thinking, I guess I better get a funeral plot and plan my funeral. It's not good. It's always extremely helpful. It's always extremely helpful too, if you want to make sure you're communicating well, is know what all your medicines are and what all your supplements are. Everything you take, either write it down. If that's too much trouble, bring it all in. I can't tell you how many times I've been confused. A patient's like, well, I take a couple of herbs and do it. And so I said, can you just please bring them in next time? She came in with 3 boxes of stuff. This was like thousands of dollars of vitamins. And I'm like, yeah, I can see why you're confused, because I'm confused. She was taking a bunch of duplicates and a bunch of other things. And so that was extremely helpful. But if we never had that come in, we never would have known that she's taking way too many things. So one way to do it, if you can just keep a list of your medications. That is the #1 thing that gets messed up in the medical record, is the continuity between doctors and hospitals and patients and pharmacies on what medicines people are on. That's why sometimes they'll have whole visits from social workers or people to do medication reconciliation, they call it. Write down exactly what somebody's taking. Try and make it match to what somebody told them they were supposed to be taking, what they're actually taking, and everything else. So even in these days of computers, that's made it a lot easier now. But boy, I can tell you right from the get-go, that's always been the biggest concern. It's also nice if it's a new physician that you haven't seen before, and even if it's your regular physician, it's nice to just have your medical history summarized somewhere for yourself, if nobody else. The reason that helps is because if you go to some place where the medical record can't travel electronically, and it can do pretty good now. We share with Stanford, UCSF, Kaiser, and Sutter now, so we can share all medical records. But let's say you go to Sacramento or something, that doesn't work there. It's nice to have that. But also it's very easy to show the doctor from time to time, and you can just glance at it. And that's very helpful too. And it keeps you organized, and if you have the important tests that you just did down there, and also the other doctors you're seeing, it makes it much easier to avoid duplicate tests and things like that. Unless you want to spend money, then you know. So, the other thing that I found that's really great now about the new medical record systems, and probably most of you have seen it, they have it now, it's basically the same, it's Epic, it's basically the same in almost all the major hospitals, is that they have a MyChart section now. So you can sign up for that, and the first thing I knew would actually worked was suddenly a patient, I had a cancellation at 5 o'clock on my schedule, and suddenly another patient popped up, and I went to the front desk. I go, "You guys are slick, you're fast." And she goes, "I didn't do anything." The patient did it themselves on the computer system. They just happened to find that opening and took the appointment. But the best thing I like about it is they send me messages. Legally we can't do it via email because it's not secure, and that would violate HIPAA laws, which are health protection laws. But you can send, I love it when my patients send me messages and I can sit down and type it back to them. Often that'll help for simple questions. For longer questions, you just have to call. And if it's a really complex thing, sometimes people just have to come in. You just got to sit down and have the give and take and talk about it and figure out what's going on. Don't discount it. I always felt like we're going to get another copay out of this person. That's not what it's all about. Doctors, one of the biggest things we go on that people don't call is called the eyeball test. You look at somebody and you kind of get a feeling for what's going on. And that just comes with experience. And that's why it's so important to be face-to-face with people when you're examining them and trying to talk to them and help them and so forth. And so I think that's also really important. And besides, I like it when people come in, I can torture them. I mean, help them. Okay. The other thing is, if you're not sure about, like I said, not sure, ask. And I think the last thing is, if you're kind of not sure what's going on, but you don't know what to ask, and that's extremely common. We've all felt like that. We're kind of over our head. We don't know what to ask. So patients will often say, "Hey, where can I look this up better?" Or where can I read about this? And then people can come back sometimes with really good questions. You can tell they've really read it. Sometimes they get answers to it, but sometimes I just say, "I'll go on the internet, it's fine." Oh, wait. The problem with that is there's so many sources and so much conflicting information, it's hard to know what to trust. So I usually steer people toward a couple of sites for their information. If I happen to know one specifically, sometimes I'll copy and paste a huge section into their printout that they have when they leave. But it's, ask the doctor, "Hey, where can I get more information?" And then next time when you come back, you can have really good questions or really try and clarify it in your mind, which is what's most important. So the bottom line is, if you don't know what's going on, ask. If the doctor hasn't made it clear, it's not your fault. I'll take the blame, but unfortunately you would take the fall. So it's better to just ask. Just ask. Most of us are really happy to answer it. There's always going to be a day when we're really grumpy and bad and we're human, and then just smack us and then we'll be fine. But, we just have to sit down and talk and figure out what's going on and do it piece by piece if necessary. And the final thing I would say is when people, what I talked about before, people who are unable to absorb this information by themselves, or people who are unable to basically be their own advocate, it's often very important to have somebody come with them. And I always joke that they're the lie detector, because I'll say, "Are you having chest pain?" The guy will go, "No," and I'll look over there and she's going, "Yes." So it helps in a lot of levels. You get information from different sources, but also that person can help ask questions and help organize and help make sure that everybody knows what's going on. I have 2 dear little patients. She can't hear a thing, but she's with it mentally. He can hear fine, but he doesn't know what's going on. And to hear them talk back and forth trying to figure out what I said, I just kind of go, "Oh no, what do I do now?" But it finally gets through. It just takes longer. So remember, write down your questions. Ask. Have a list of your medical information. If you need more time, ask for it and plan ahead for it. Figure out how you can communicate with the doctor after you leave the office. Because like everybody says, I'll say, "Do you have any questions?" "No." And I said, "Don't worry, you'll have more after you leave." That's very common. So remember how you can communicate. Get an advocate if necessary. And when in doubt, ask. Thank you.